Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. My name is Bryce Patton, here with Sid Roeder, my co-host. How are you, Sid?
Good morning. I'm wonderful. Always when I get to spend time with you.
Oh, that's good. And you're indoors.
Yes, I am indoors.
And it's not cold in here, so that's wonderful. Well, we have a fantastic show planned for today with a wonderful guest, someone I've known for quite a while. But before we dive into our guest, you want to tell us about our sponsor?
I would love to. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anyone that loves to listen to us on radio, because this is how we do this. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CB stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can reach me personally at 435-512-6406.
Thank you so much. Have you had any calls to action lately? Or anyone calling?
I have had a few calls on our guests to connect people with who we've had on the show, yes.
Okay, wonderful. Good deal. All right, well, let's introduce our guest. We have Angela Martinez. She's a licensed clinical social worker and mental health therapist for Intermountain Health. Welcome to the show, Angela.
Thank you. I'm happy to be here.
I'm happy you're here. Your daughter and my wife have been friends for years and years and years, and so I've been really excited that this works out, that you come. But I know you very well, but our audience might not. So you want to kind of introduce yourself, why you came into this field, and kind of what makes you get out of bed in the morning?
I would be happy to. I've worked for Intermountain Health since, I believe, 2012, and prior to that I did an internship with them. And I've worked in various positions with Intermountain. I worked in their emergency room for 4 years as a crisis worker over at Bear River. I was a care manager for a pilot program out of McCady for about a year and a half. I've had a private practice. I worked hospice for a couple of years, which honestly I absolutely loved. I loved hospice. Then there came this position in mental health integration. It opened up, and a friend of mine told me about it, and I applied, and here I've been working in mental health integration at the Budge Clinic for 8 or 9 years now, I think, and I have loved it. So basically I provide therapy in one clinic for the community in psychiatry, and then in 3 family practice and internal medicine clinics, different days of the week. And so all of the providers in those clinics refer their patients to me for mental health therapy.
And before the radio show, I had to ask to understand a little bit how this works. And maybe just because I had that question, maybe some other people do too. Do you want to explain a little what the process is and how people actually end up being able to talk to you?
Absolutely. So in psychiatry, there's actually 3 of us that work in mental health integration, myself and 2 psychologists, Ken Wygand and Tyler Christensen. And we all 3 work in 4 different clinics. So we each do 1 full day in psychiatry in the Budge Clinic, and anyone in the community can call and make an appointment with one of us. And then the other clinics, we are integrated into, I work in the Logan Clinic behind Smith's on 400 North 1 day a week, and all of the providers in there, nurse practitioners, PAs, and physicians, they can refer their patients to me for counseling, basically therapy. And like I said, all 3 of us are in several of those clinics per week, 1 a day. And it's been really wonderful. It's been really fulfilling. I would say that most days at the end of my day, I feel very fulfilled and very grateful and happy that I could help people make that positive change in their life and overcome their struggles.
You bring up a wonderful point. Before we were talking about this, in my mind, and you just sit there and think, oh, I've got to go to therapy. You imagine sitting on a chair and just complaining the whole time. At least that's what I feel like. But as you were talking about, that's a lot more that goes into it than that. And you want to kind of go into what your approach is as you get to see a patient and kind of explain that process and see what if this triggers something for one of our listeners.
Oh, sure. I'd be happy to. So when a patient is referred to me, they have to fill out what is called a mental health integration packet, and it's probably about 6-7 pages, and they're filling out information that gives us sort of a holistic idea of what is going on in their life. So we want to know about their medications, socially how they're doing, their physical health, what their actual struggles are, why they're coming to see us, their family history, all kinds of things. And then when they come to see me, I have my own questions that I want to ask more in depth. I really want to see that person's life and that human being in all the different areas, like psychological, like mental, emotional, spiritual, social, all of those aspects. I want to see what their protective factors are, their strengths, if you will, and I also want to see where they're out of balance and maybe where we need to start focusing in on to help them. And
do you find that people are afraid to open up to you, though?
Sometimes people are. But I've also mostly seen that by the time they're brave enough to make that appointment and come in, they're ready to talk.
So do you dive into like deep things your first session, or does that usually take a little bit before you really start diving in?
That's a good question. Most of the time people come in and I can just do my assessment and we can talk about, at the end of the session, I'll say, here's what I noticed. I'm seeing this is sort of out of balance and this. What do you think? This is about you. So you tell me. I think maybe we could work on these things, but it's really more about you, not what I think. And they might say, well, yeah, those things are out of balance, and maybe this and this. And then also, there are times when a patient will come in and I get out the words, hi, I'm Angela, welcome, I'm so glad you're here. And they just unload. And I sit and I listen and I validate their feelings and I don't try to derail them. What I'm doing is a couple of different things. I'm validating their feelings. I'm being a sounding board. I'm being that person that cares about them. But I'm also getting a baseline. I'm assessing like where they are, and then I'll take that baseline and then we'll add to it when I see them again and again, right? So I'm trying to figure out who they are, where they're coming from, what they're needing, and I just let them talk. Some people just need to come and dump that first time, and I totally get that.
So with you saying that these services are open to the public, I know there was a specific day, but how would someone who's maybe listening to this radio show and is feeling distressed and would like to talk, what's the process? Where do you know where they need to call?
I do.
Is there a phone number you can
Yes.
share? How does that work?
So for anybody in the community that wants to come in and get therapy from either myself, Dr. Wygand, or Dr. Christensen, they would call Psychiatry at the Budge Clinic at 435-716-1280.
Thank you so much, Angela. We're already coming up on our first break here, but we'll be sure to mention that phone number again. So if you want to grab a pen and paper, we'll be sure to mention that again. Again, this is the Senior Moment Show. We are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. This is the Senior Moment Show. We're going to take a short break. Stay tuned. We'll be right back.
At Maple Springs Senior Living in North Logan, we understand that entrusting the care of your loved one to someone else is a decision not taken lightly. That's why we go above and beyond to create a nurturing environment where your family becomes our family.
When I found Maple Springs, it was like a weight lifted off my shoulders. The staff here really cares, and Mom is thriving.
The activities and social events have brought so much joy to Dad's life. I can see a positive change every time I visit.
We know that your loved one's well-being is your top priority, and it's ours too. Learn more at maplesprings.living.com.
Thanks, Mom. Thanks, Dad.
No problem, sweetie.
I can't believe you're able to fit everything in that little sedan.
When they move out, you can move on to a house that fits your life. It's time to live in a space that fits your family.
Hi, this is Sid Roeder with Achievement Realty.
Let me help you to find a home that suits your needs and is less to take care of. Save money or even make money on the sale of your current home. Call me today at 512-6406, then list it, sell it, and move on.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
And welcome back to the Senior Moment Show. My name is Bryce Patton here with Sid Roeder, and we have been speaking with Angela Martinez, who is a licensed clinical social worker at Intermountain Health. And we've been talking about mental health with seniors and kind of what mental health, what that entails and why you do this. But one of the things, it's wintertime, it's cold. I imagine those are some of the things that might play into factor with some of the mental health that goes on with seniors, but maybe you could elaborate on what you see in your clinic. What are some of those pain points that you're seeing with a lot of people that come to talk to you about what's going on?
Yes, of course. A lot of life changes can be a risk factor for people that can cause them to be stressed or feeling isolated and sad. A death of a loved one or retirement. Retirement's really big, or dealing with a serious illness. Most or many older adults will eventually adjust to these changes. Loneliness and isolation are definitely key factors, and also poor health or abuse or dementia.
So I'm a little curious, when someone comes into you, how do you open, or what are some of the warning signs that you pick up on that might be relevant also maybe to some of our listeners interacting with people? What are some of the warning signs you're looking for?
That is a really great question, and I actually have a list of those here. A change in mood or energy level or poor concentration. If you notice a change in your eating or your sleeping habits, if you're waking up a lot at night, or maybe just not feeling really rested when you're waking up in the morning, withdrawing from the people and activities that you used to enjoy, or if you're finding yourself feeling unusually confused, forgetful, angry, upset, worried, or scared, or you're just feeling sort of apathetic, not feeling normal feelings, if you have unexplained aches and pains, or if you're feeling sad or hopeless about your future. Also, excessive guilt, or you're feeling this low self-worth. If you're smoking or drinking or using drugs more than usual. Also, anger, irritability. If you're having thoughts and memories that you can't get out of your head, so kind of obsessive thinking. If you're hearing voices or believing things that are not true, that's pretty extreme. That could maybe lean into psychosis. Or if you're thinking of harming yourself or others, of course, that's a pretty big indicator there.
So you mentioned quite a few of these, but some people are like, they're not able to sleep. And I mean, I have those nights. Is it over a span of time that they're seeing these symptoms, or is it, hey, this has been going on for a week and I'm done, or hey, it's been a few months, I really need to get this taken care of?
That's a good question too, Bryce, because it's usually like a significant life change that will trigger that excessive worry, perhaps, or fear or whatnot that disrupts our sleep patterns. So if this is happening out of the blue for no reason, and it starts to become like interfering with your life and making it difficult for you to function during the day, then you probably should see your primary care physician about that,
So that makes me a little bit curious, because I don't know. Is that like some of the standard question catalog for the primary care physicians to investigate on these things?
Sleep issues are actually probably the primary question that either myself or my colleagues or the healthcare providers will almost always initially ask about, because sleep disturbance can actually either cause anxiety or depression or exacerbate symptoms that are already there. Because, and this is how I explain it to my patients, when a human being is getting what we deem as healthy sleep, then their brain is healing. And when they are not getting healthy sleep, then it can either cause anxiety or depression or other issues, mental health issues, or it exacerbates the symptoms that are already present. And so we're wanting to make sure that that person's sleep gets healthier right away.
When you're talking about healthy sleep, is this, hey, they're sleeping well for 8 hours in their own bed, or is this some people taking naps in their recliner during the afternoon? Like, so what?
Healthy sleep is seen as you can fall asleep within 15 to 20 minutes generally, most nights. You're not waking up more than a couple of times a night. You're able to probably get right back to sleep. And then when you wake up, you're feeling rested. That's what we deem as healthy
So the
sleep.
big key word is you're feeling rested at the end, probably.
Oh, for sure.
Okay.
Yeah.
So what are some of the treatments that you can offer? I mean, I'm assuming that has to do with diagnosis of why there are issues, but maybe you can give us some of the ones that you come across most.
Oftentimes, when I am initially meeting with a patient and maybe they haven't seen their doctor in a while, I'll say, when's the last time you've had a full physical with like the blood panel, everything? And sometimes it's been a while, and I'll say, please make an appointment with your healthcare provider. What they need to do is rule out any type of health issues that could be contributing to their mood, which could be things like, especially in the winter here, low vitamin D, or thyroid issues, or low iron. Those things can definitely impact your mood and your energy levels. So we want to have their healthcare provider be a partner, right, with us. Medication can also be an option, and that's a conversation that I like my patient to have with that healthcare provider. I don't really talk a lot about that. I might try to give them some psychoeducation about it, but I stay within my scope. I prefer the doctor to talk to them about that. Also, I might encourage anyone who is going through these experiences to make an appointment with a therapist and or join a support group. Support groups are very powerful interventions. When you know that what you're going through is shared by other people, there's something very impactful about that can really help. And also talking to someone that you trust can be really helpful. Many of us have that person in our life, right? A best friend or a neighbor or an ecclesiastical leader or somebody that we can go to and say, here you go. This is what I'm going through. And just getting that validation and that comfort from that person can also be really helpful.
You know, you mentioned support groups. I've run those in the past, and they really are wonderful. And I hate to put you on the spot, but are there certain ones that you suggest, or are there some at the hospital? Do you know where people can look to find those support groups?
Actually, if you just Google support groups in Cache Valley, but there are two that I really do love, but I know that there are others. There's a peaceful healing support group run by an LCSW colleague of mine named Dennis Wildman. He's through Sunshine Terrace, and they do it. It's free, and I believe they meet on Wednesdays. And it's a grief group, and it is wonderful. I have had so many of my patients go to that support group. And then also there is a caregiver support group run by the same agency that I believe meets on Mondays, also free.
Thank you, Angela. We're already coming up on our second break here, Angela, so I'd love to have you mention one more time what days it's available to the public and the phone number where people can make an appointment.
So to make an appointment in psychiatry, just call 435-716-1280 and just ask if you can make an appointment with a therapist, and they'll line you up with either myself or one of my colleagues, Dr. Ken Wygand or Dr. Tyler Christensen.
Thank you. This is the Senior Moment Show. We are at our next break here. I'd like to mention our sponsor really quick, who is the Empowering Seniors Group. If you'd like to learn more about them, you can do so at empoweringseniors.info. We're going to take a short break. Stay tuned. We'll be right back.
Hi, this is James Stevens with White Pine Funeral Services. At White Pine, we value compassion, integrity, and service. We are committed to serving you and treating your family as our family. We will be here when you need us most, to listen, to help, and to provide exactly what your circumstances require. At White Pine, we promise to dedicate our time and attention to you and your family. We invite you to come by and meet us. We're confident you'll feel a difference.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older, and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
And welcome back to the Senior Moment Show. My name is Bryce Patton, here with Sid Roden, my co-host, and we've been speaking with Angela Martinez about all things mental health. We've had so much information given us today, and so we appreciate that. If somebody is really needing help, what are some of those symptoms that they should just call and get that appointment immediately, or go to an emergency room or something like that? What
if a person is having thoughts of self-harm, or thoughts that they want to, or just have thoughts of harming another person? That's significant, and it would be important to talk to a mental health professional, especially if they have intent or a plan. And that is important to know. And what will happen is, what's important to do is to reach out to either your healthcare provider or go to the emergency room. We also have a behavioral access center in Ogden at McKay where you can just walk in. But if you can, wherever you want to go, get there safely, with someone. If you have to, call 911 and say, I don't feel safe. And you'll be taken, to the emergency room. Well, you'll be assessed by a crisis worker in the emergency room, and then they will help decide a plan of action, like whether you need to be hospitalized or seen by a crisis worker and given some tools until you can meet with your healthcare provider or your therapist.
Okay.
Thank you, Angela. That was all very valuable information, and I think it's also great to be reminded as a member of the community to maybe keep your eye open to see if you can detect someone who's in distress and offer a helping hand here to maybe connect them with you. On a happy note that we'd like to end on, if someone is really interested to be mentally healthy, what are some of the prevention tips you have for people to not fall into these deep depressions?
Well, first of all, before I say that, there are genetic predispositions, right, to mental health, and it would be important to really take care of yourself physically. That can be a huge help. There are situational types of depression, and then there's sort of that genetic type of depression. And it's just important really to take care of yourself physically, to stay physically active as much as you can, to eat as healthy as you are able, to stop smoking and drinking alcohol. Alcohol is a depressant, so that's really important. Get regular checkups with your doctor because they can help you stay on top of different types of illnesses and diseases and whatnot that can also be difficult to deal with. Write down everyday tasks and appointments to help you remember important things. Sometimes our recall as we get older isn't as good as it used to be. And then keep up your hobbies and things that you enjoy. It's really important to do that. And then try new ways to keep your mind active And then spending time with your family and your friends and engaging with your community can be really important. I have found that staying connected and being, connected with the people that you care about and engaging in activities that make you feel like you have a purpose is very significant.
Do you think that ties into why people struggle when they retire?
Yes.
That big?
Yes. I have heard that a lot over the years for people that retire and then their structure is gone and they sleep in maybe a little too much, or they become less engaged with people that they're used to seeing on a day-to-day basis, and they kind of have to recreate themselves and find ways to keep themselves engaged in their community and with other people.
Yeah, I think that's very important just so people are aware of that. I always think, retirement, I'm going to go fishing every day. But I might not be like everyone else, and that throws things off.
Right.
I was curious, do you have any success stories that really stand out in your mind as you've been able to see this over those years and people that you might have been able to help out?
I do. It would be hard for me to recall maybe something specific right now, but I will tell you that one of the most important things that we can do as mental health providers is to help that person understand that we really do care about them. And then when people that come in to see us, when they feel and know that we care about them, that can be really impactful. And so going to someone that maybe is a neutral person that will listen to you, not judge you, and help you sort of unpack things and reframe how you think about things. And just, like I said, just knowing that we really do care. Like, we really do care about how they're doing and how they're going to move forward in their life, and we want to help them.
Thank you, Angela. I think that was very valuable. This also, of course, ramps me up to ask for the contact information and where to go one more time.
Okay, so the phone number for Psychiatry at the Budge Clinic is 435-716-1280.
Thank you. Thanks for all your insights and sharing that with us and allowing our listeners to learn that there are places that you can go to reach out for help. This is the Senior Moment Show. Let me again mention our sponsor, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com. And the CV stands for Cache Valley. Sadly, we're at the end of our show. We hope you tune in again next week.